I believe that probably likely happened when I was younger.
So you noticed primarily the sleepiness in the front part of the brain. Was there anything else that was significant?
Her emotional brain was really active, because when you experience trauma again and again, it takes the limbic or emotional part of your brain and it activates it.
Okay, that is true, right? That is true. But I'm starting to wonder, and I hate this. Like, I know there's like brain scans and stuff like that, and certain like times when one heats up a little redder than the other part of your brain. And I just wonder if all the time those kind of tests are true. Now, we do know that the frontal lobe does hold like reasoning and stuff like that. After pattern recognition, if people get hit in the frontal lobe too much, they start to act different, or at least, to be honest, so I'm told. I'm starting to question things, and I know that it's a dumb question, but it's really not. Some of these, like when you show me these images, like, oh yeah, this part was hotter and that part started to, really, but it's all theory at the end, because like, where's the correlation where you tell me that the blood flow on one side of the brain is increased, which means that somebody's getting extremely emotional? I don't know. Maybe I'm just, no, I do know. I know exactly what I'm asking.
This was a situation where you experienced memories that were locked off for 25 plus years. Was it like they had happened yesterday, or were they like distant memories for you?
It was like it was happening now,
Right.
if I'm honest. It was as if I got in a time machine and I was in that terror so it was very present.
Were you in a relationship during this period, during this time?
Thankfully, no, not for most of it, for his sake. But I did meet someone and I kept pushing back. We did end up having a little bit of relationship for a few months, and that was when the reintegration moment happened.
Okay, so Dr. Phil is talking to AnnaLynne McCord. Apparently, she was on 90210, and he's talking to her. Face does look familiar, but I wasn't a 90210 girl. And he's talking to her about what happens in her brain when she's having dissociative identity disorder. You see, the identity disorder part is what bothers me, and it always brings me back to borderline personality disorder. Borderline personality disorder is a diagnosis that I do not adhere to, but I do reference as a real diagnosis. But okay, so for the person who doesn't know me, my name is Casey, right? And I'm a nurse. I'm a registered nurse. No, I'm not a doctor. Allegedly, everything, right? And these are all opinions. Like, we're just having conversation. But I also have education in this part of, medicine when it comes to mental health. I love psych nursing. I absolutely love it. I love psych nursing. And I always thought I would hate it when I was in school. But so when I say that, though, like borderline personality disorder, you see it. You do see it. You can understand where it comes from and why people act the way they do. But when we start branching off to like adjustment mood disorder, dissociative identity disorder, that's not what it was called. Disassociation is when you pull away from yourself. Where does there's not an identity that comes in and replaces. You just lose time and you pull away from yourself, or sometimes you can even see yourself outside of yourself.
What we see with trauma is their emotional brain becomes lit up, and the brain works through association. So a smell or a tone of voice or a look from someone else that has nothing to do with it, all of a sudden can trigger, re-trigger that emotional brain to fire up, almost like a seizure. And most people who have dissociative identity disorder, they actually end up with 5 to 7 other diagnoses first. But when the standard treatments aren't working, you need to delve deeper. And it would have been hard with you because you didn't remember the early abuse. It's like, no, everybody was fine.
Yeah, and that's difficult when you have to rely on the patient to be a reliable historian.
And your brain is always listening. there's how to rewrite your own story. And I have people go year by year. And it's interesting when they actually take the time to go year by year, what good thing happened, what stressful thing happened, it often begins to trigger those significant memories. And the ACE test, which is the Adverse Childhood Experience test, and she scores an 8, which above 4 is associated with all sorts of bad things, including dying early and a higher risk of suicide. This is one of the most important public health issues we can deal with. When there's a
Okay. You know what? We're gonna look into this. What this is that's going on with this woman. I'm a very skeptical person. I am skeptical. Yes. I am. And it's helped me in my career.
There's a lot of adverse childhood experiences. We have to intervene early because it not only protects them, it protects their babies and their grandbabies.
At this point, do you consider yourself integrated?
Yes, sir.
Obviously must have had a lot of hard times in her life or whatever. The problem is, and she's been battling with dissociative disorder. Okay. But my thing is this, you definitely should have a good, healthy lifestyle in these kind of situations. I don't doubt that maybe she's gone through something in her childhood, life. Here's the problem. I think that we've gotten to the point though, where it's always like therapy, which I do believe in, but where we dredge up these old memories. What about if we just dredge up just enough? You were abused, right? You don't need to know the whole details. You don't need to put yourself back there again. Because maybe the defense mechanism of forgetting, of repressing, is one given by God to say, put that away, because you're going to have to take from that sometimes. It's a part of you. You take from it a little bit to continue to grow and become better. Now, it sounds radical. It's really not. It's not. We don't have to remember every bit of the detail, just enough to let you know this is something that happened to you. Now you're going to use it to make you stronger, because in the name of God, whatever doesn't kill you, make you stronger, right? I know it sounds insane, but it's really not, because what is it? Like, and when people say somatic this and that, it's fake pain. That's really what it is. Sometimes. Virtual hug. So we already annoying, right? You know what I mean? So I found this. I figured I'll add it. We'll do a part 1 and 2, and it'll be good. This is her visiting the Amen clinic, and it's so fascinating that his last name is Amen. Like, you are so annoying. That's not your real last name.
How are you?
So nice to meet you.
So nice to officially meet you. I'm so excited about today. For me, my heart is to change this narrative around the behaviors that follow trauma, and not treating someone or responding to someone or judging someone for their actions, but asking what happened to you. Like, how did we
talk about how much of a weird time this was in life when we were wearing lace masks? Okay. I just felt like I needed to make that, point. Okay. Now let's just move on, because there's a bunch of, yay, whoopsie daisies and all this. So let's. Just...
The brain is cool.
The brain is very cool.
Yeah. The brain is in too, which I get excited about.
I love that.
So you've come out publicly that your rape when you were 18 ultimately triggered the memories of the child sexual abuse.
I don't have anything until around 5, and then from 5 to 11, I recount incidents throughout. And then when I was 13, I have a singled out memory that was just one thing that I don't have anything. I don't have the sense of anything else anything else at that time. The way this is talked about is there's so much shame. And I am absolutely uninterested in shame. There is nothing about my journey that I invite shame into anymore. And that's how we get to the point where we can articulate the nature of these pervasive traumas and stuff, as horrible as they are. So
do we ever get a recounting of the trauma? And I don't want to hear the gory details. We're going to come back. Hold on. I'm just at the point. Oh, here we go. And what is her name? AnnaLynne McCord. Let's see. Trauma. Like, what exactly happened to her? Here, let's read something from people.com. And, okay, so AnnaLynne McCord on her identity disorder and coping after, situations. I've experienced hell. Okay, fine, if you say so. After nearly 2 decades of living with fear and uncertainty and all-consuming identity disorder, actress AnnaLynne McCord has finally found peace and is opening up her journey. I've experienced hell, she said. Okay, she developed this thing, a mental illness characterized by presence of 2 or more distinct personality traits. This is just too many changes in the DSM-5s for me. I'm not really with them. I'm just going to drop this here. And healing, okay, blah, 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 as a way of coping with severe situations as a child. Hold on, because maybe this is the part where they tell us. Okay. Jesus, she remembered it. Because it's like, you know what I mean? It becomes a spider web. You're just trying to, after being situated, because it's a shame, right? At 18 by a friend, she sought treatment for the situation. And so we are looking, members of the child would come back to me all the way I was 11. Now, this is about my life story. Growing up, she said she believed she's equated, intimacy with love. So what did I do? I wanted to be loved. I thought, you know what, guys? I'm sorry. Maybe I'm late to this story. Now McCord, who serves as the president of Anti-Human Situations, Together Heart One, has made a decision to make sure every single person on the planet knows what love feels like. She added to be able to be a part of something where young men and women, boys and girls have. Okay, so just so you know, like, I definitely am like all for getting this together, except for nobody goes to the head of the snake on this one. That's why I know people like content more than they really want solutions, though, because there is a head of the snake, but it might be too controversial. I would definitely lose my channel. Okay? I do have to start going live again. I do. And then we can talk about it there, and then I can just list it. Anyway, coming back to it. But whatever needs to be, maybe you find some victims, and then you can help them out, get some help, or whatever, that's good. I'm sorry. I personally don't think that anything happened to this person. In a sense of, I don't think it's what we normally call essay. Hey, drop a comment below and let me know how you feel, because I'm not seeing anything. We are in a society, we are in a time right now where people use words too loosely. I know I'm probably going to lose I don't care. I'm going to just tell you how I feel. We don't have to agree on this. You let me know. Because it's like, I thought intimacy was love and, all of those kind of stories. And it's like, well, yeah, I've been through that too. I'm sorry. I've been through that for a very long time. And I'm not trying to say, oh, because it was me, then it's you and da-da-da. But I'm not hearing, usually you'll be like, yeah, when I was, a kid. And if you want to go ahead and talk about it, right? And there you go. I see it right there. If you want to talk about it, you normally be like, yeah, there was a friend in the family. We just kind of thought, and then boom. Boom. Even if you say that, there's not anything being said here. This person is telling you that they thought intimacy was love. In her first person cosmopolitan essay, McCord wrote candidly about her devoutly Christian, physically abusive upbringing. And the night she woke up to find a male friend situating her in her, and I'm not saying situating to minimize it, I want to be clear, in her apartment at age 18. And maybe he did take advantage of her. Maybe he did. How did he get inside your, okay, all right, okay. Okay? Because y'all are going to be, do we want to have the conversations or not? Guess what? This is the channel for the inconvenient truth, right? And I don't know her truth and I don't know her story. I just feel like subjectivity plays a huge role nowadays in situations that can get people in a lot of trouble. I'll just leave it at that.